rapid changes in global healthcare outlook. As a result, the COVID-19 epidemic is putting a huge burden on global healthcare infrastructure, supply chain, and workforce. The COVID-19 is causing a transformation throughout the healthcare ecosystem, requiring a rapid adaptation and change of private and public healthcare institutions. Issues in the global healthcare industry in 2021. Industry leaders are expected to leverage the momentum generated by organizational and ecosystem reactions to COVID-19 in 2021 to solve key sector concerns. Transitioning from conventional clinical procedures to customized care through digital transformation and interoperable data using artificial intelligence, AI, to deliver real-time care, interventions, and nudges to alter customer behavior and habits. Programs that enhance a person's complete well-being. Socioeconomic changes recognize the importance of concentrating on neglected groups and collaborating with governments to change policies and programs. Changing the focus from acute treatment to preventive and well-being is an example of care model innovation. Moving away from conventional clinical practices and toward individualized medicine, value-based/outcome-focused payment methods are evolving, as is universal coverage, making changes to financial operations and performance, work and talent, new business models, exponential technologies, and agile working styles are introduced. Analysis of capacity and demand to fit the pandemic's requirements, the use of remote workers, clinical and non-clinical. Consumers increasing ownership of their health and data. Consumers increased ownership of their health and data. Clear and unambiguous information about treatment options and costs. Achieve a balance between virtual appointments and a connection with a trustworthy physician. Collaborations. Ecosystems that allow for real-time data and analytics and function as educational, preventive, and treatment centers. Consumers are connected to virtual, home, in-person, and auxiliary care providers through ecosystems. Healthcare technology trends on the rise. Healthcare trends don't come and go as quickly as fashion trends. When a major new transformation begins, it generally takes several years to grow and ultimately endure. The following newbie trends, many of which acquired traction due to the epidemic, seem to me to be long-term prospects. Specialty healthcare digitization. Primary care appointments aren't the only ones that have gone digital. Digital pathology is a fantastic illustration of how more healthcare disciplines embrace the digital era. Whereas pathologists used to spend much of their time hunched over a microscope staring at slides, they can now be digitally shot and examined more readily on a wide computer display, and the data may be used for other consultations or research. Similarly, radiologists are adopting medical imaging digitization. Scanning allows an X-ray to be transmitted from a rural clinic to be evaluated by radiologists throughout the country, and related software can assist with picture organization, prioritization, and interpretation. Meanwhile, virtual reality systems allow surgeons to rehearse an operation using the patient's medical pictures. Rising AI adoption. Healthcare has been slower to adopt and integrate AI and machine learning than other industries, but the floodgates are now open, from scheduling and administrative duties to detecting anomalies in imaging. AI has primarily served as an assistant, assisting medical professionals on the back end to make their work faster or easier. Nevertheless, as programs become more sophisticated, they will perform more complicated tasks and become more like an experienced colleague than an assistant. In addition to developing trust in AI, a major factor in its acceptance, patients are particularly receptive to its use in conjunction with a real doctor. It has the potential to be incredibly useful, sometimes even outperforming medical professionals in terms of vision, but it will be most useful when combined with a human brain. Cloud-based health systems. The preceding developments are based on a complicated technological basis, which is why another revolution, shifting health systems and data to the cloud, will be critical. Doctors' offices, radiological laboratories, pharmacies, health insurance companies, patients, and other stakeholders must interact inside the healthcare industry's enormous networks, including those of universities and hospital systems. Novel solutions like patient portals are becoming viable thanks to cloud-based platforms, which provide interoperability and a safety mechanism for essential information to be delivered swiftly and conveniently from anywhere at any time. Precision medicine. Precision medicine, or healthcare personalized to you, is a result of our digital age, in which genetic testing is now available, and wearable devices, such as Fitbits, can scan vital signs in a flash. Because this type of health data is readily available, physicians may design personalized treatment regimens for each patient. Patients benefit from precision medicine in cancer immunotherapy and medications specifically developed for cystic fibrosis patients with specific gene mutations. Furthermore, due to digital imaging and 3D printing, folks who require medical equipment can increasingly have them custom designed and scaled. Increased AI usage is hastening these advancements in precision medicine.